Do you find yourself checking a lot of your body sensations? Maybe you spend a lot of time Googling your symptoms, or do you spend a lot of time in your head ruminating, trying to figure out what is going on in your body? And are you getting sick, or would you get sick? And the endless amount of concerns and worries that you might get to. I spend a lot of times with my clients differentiating between health anxiety and OCD. And there is a lot of overlap. So, my agenda today with you is to help you understand the differences between health anxiety and OCD and to help you with a plan if you are dealing with both. Hi, my name is Kimberly Quinlan. I am a licensed therapist and I specialize in OCD and OCD related conditions, including health anxiety. My mission here is to help you suffer less and to find more joy and presence and peace in your life because anxiety can absolutely take that away from you. What I'd like to do today is to show you the difference between OCD and health anxiety by showing you a Venn diagram. This is a visual where you'll start to see the overlap and the differences between these two different conditions. So let's take a look at OCD first. Number one, OCD has an onset of intrusive thoughts, feelings, sensations, urges, or images. Now, these are all unwanted, they're intrusive, and they're very repetitive and distressing. Now, they can focus on any topic, any situation, whether it be relationships, your religion, your safety, your health, your family, your friendships. There is no limit to what OCD will touch. It will also include behaviors like compulsive Googling and reassurance seeking. There is a tremendous degree of avoidance compulsions when it comes to OCD. And there are a lot of checking behaviors, counting behaviors, praying, repetitive behaviors of any kind related to that one obsession. And the last thing is there is a very strong overlap with a lot of rumination for folks with OCD. In fact, if you have OCD, we call it mental compulsions. Now, if you're interested in learning more about OCD, we actually have a whole course for you that goes deep into the symptoms of OCD. We'll help you walk through step by step what I do with my clients and show you how you can then build a plan so that you can go forward and recover from OCD. Now, we also have a course for clinicians. If you're a clinician wanting to specialize in OCD and you want to get a handle of the differences of OCD, how to handle it, the gold standard treatment, that is there for you as well. And all the information will be in the show notes. But let's get back to the differences. Okay, so we now know what OCD looks like. And now we want to go through health anxiety. Now let's take a look. Health anxiety has a persistent worry about having or developing a serious illness. Again, it's that intrusiveness of the thoughts and the feelings and the sensations. It often centers around catastrophized body sensations. So often you'll have a sensation, maybe a headache, a bump, you might have a tummy ache, it doesn't matter. Your brain will then attack that symptom and become convinced that this is the onset of a terminal illness or a very catastrophic illness. Again, as I said, the thoughts are intrusive, unwanted, very repetitive, very distressing. And in this case, the thing to remember is sometimes people with health anxiety have a medical issue, or often they won't. It could be that they just notice a mole or they have a very small headache, and that brain, again, catastrophizes it. There's a lot of body checking going on with folks with health anxiety. There is a lot of compulsive Googling and reassurance seeking with loved ones or family members. And there's a lot of avoidance of medical tests, doctor visits, and so forth. And then the last one is there is a lot of mental rumination. So what we want to do is we want to understand that both of these conditions will have intrusive, repetitive thoughts and sensations. They will both include checking, whether that's cognitive or physical. There's a lot of reassurance seeking. There's a lot of avoidance and a lot of rumination. They both cause significant degrees of distress, and they both have behaviors that reinforce the condition, reinforce the anxiety and the uncertainty. Now, there are some differences. The underlying core fear is different depending on whether you have health anxiety or you have OCD. For health-related OCD, it might involve fears of contamination, or it might be the fear of causing an illness or causing harm to other people via disease or some kind of other illness. And in this case, there's a lot of hyper-responsibility and harm OCD is what we call it. With health anxiety, it tends to focus more on yourself getting sick and your own terminal illnesses that may be a potential. For health or body themed OCD, the fears are related to causing others to get sick, fears of moral wrongdoing or of an illness spreading unintentionally. This happened a lot during COVID. Or it might be a somatic obsession, which is where you feel like you can't stop noticing certain sensations, but you're not afraid of them turning into an illness. You're more just focused on whether you'll ever stop noticing that sensation. And these are really common for folks with OCD. Now, the cool thing is the treatment for both does look very, very similar. So whether you have one or both, you can use the same treatment techniques. Both are treated using cognitive behavioral therapy and exposure and response prevention. So I really want to reassure you here, this is what the gold standard treatment is for both. And both of these can target both conditions, which makes it a ton of less work for you because at least you've got one thing that you're focusing on. We also have some amazing supplemental treatments for these conditions, including mindfulness, acceptance and commitment therapy, and self-compassion. We recommend all of those in addition to CBT and ERP for health anxiety and OCD. The one thing I really want to emphasize here is that recovery is possible with the correct treatment and the right support. I really want you to feel hopeful after watching this video that number one, you know the difference between health anxiety and OCD, and you have a pretty good plan moving forward if you think you have one or both. Now, as always, thank you so much for spending your time with me. It has been an absolute pleasure. I know how valuable your time is, and so I cannot wait to spend some more time with you in the next episode.